12 signs of prostate cancer men often ignore. After 50, save your life. Imagine if you could protect yourself from one of the most dangerous cancers for men today, prostate cancer. This is a silent killer that takes tens of thousands of lives each year, quietly progressing without warning. But there is a very important good news. This disease is completely preventable if detected early and treated promptly. This means you have more control over your health than you think did, According to reliable data from the US National Institutes of Health, prostate cancer is not only the most common cancer in men in the US, but also the second leading cause of cancer deaths. The alarming truth is that 1 in 8 men will be diagnosed with prostate cancer in their lifetime. That's a huge number and shows how widespread its impact is. In 2024 alone, more than 30,000 men will die from the disease, and in 2025, more than 100,000 men in the United States are expected to be diagnosed with the disease. These numbers are not just statistics, they are lives, families. The good news, prostate cancer is not a death sentence if you recognize the warning signs early and take timely action. Early detection is the golden key, opening the door to effective treatment options and a healthier life. The biggest problem, most men often ignore their prostate health until the disease has progressed too far. This lack of understanding or subjectivity is the biggest barrier in the fight against this disease. Your prostate, a tiny organ with a big responsibility. To better understand prostate cancer, let's learn about the prostate itself. This is a rather modest organ, only the size of a walnut, located in a strategic position below the bladder and in front of your rectum. It surrounds the urethra, the important tube that carries urine and semen out of the body. The role of the prostate is not small. Producing fluid, this gland secretes a special fluid, accounting for about 30% of the volume of semen. This fluid is not only a means of transportation, but also contains nutrients that help nourish and protect sperm, ensuring they have enough energy to move and survive. Supporting the ejaculation process. The prostate also plays an important role in muscle contractions during ejaculation, contributing to male fertility. When the prostate has problems, especially cancer, it can seriously affect both your urinary and reproductive functions, as well as your overall health. In this article, we will delve into 12 early signs of prostate cancer that most people often ignore. These signs can be very subtle, easily mistaken for aging or less serious health problems. However, recognizing them in time can be the thin line between being cured and facing unfortunate consequences. So if you are a man over 40 or have a family member, father, brother, who has had prostate cancer, this article is a must-read and should be shared widely. It could save a life. The most important things you need to know about prostate cancer. Although prostate cancer is a very common disease, it often hides silently in the early stages, making detection often late and subsequent treatment much more complicated and difficult. The silence and lack of awareness surrounding this disease only increases the risk for men. Did you know? Age is the biggest risk factor. The risk of developing the disease increases significantly after the age of 50 and is most common in men over the age of 65. This emphasizes the importance of regular health checks when you enter this age. The worst part, prostate cancer can develop without any obvious symptoms in the early stages. It is like an uninvited guest quietly hiding. However, as the disease progresses, it can cause a range of unpleasant symptoms, from urinary disorders such as difficulty urinating, frequent urination at night, to painful aches and pains in the pelvic area. Recognizing these subtle signs and proactively going for regular health checkups and prostate cancer screening will significantly increase the ability to detect the disease early, thereby giving you the opportunity for effective treatment and a better prognosis. Never ignore the signals your body is sending you. 12 early warning signs of prostate cancer that you should not ignore. Listen to your body. If you or a loved one experiences any of the following signs, don't hesitate to talk to your doctor immediately. Early action can make a big difference. Blood in the urine, hematuria. Do you notice that your urine is light pink, bright red, or dark brown? It could be blood, also known as hematuria, a warning sign of prostate cancer, especially when the disease is in the advanced stage. Although it could be due to a bladder infection, urinary tract infection, or kidney stones, you should never be subjective or self-diagnose. Go to the doctor for an accurate examination. Difficulty urinating or weak urine. Stream. Do you feel like you cannot urinate completely? Have a feeling of residual urine? The urine stream is clearly weak or is interrupted and you have to strain to urinate. This could be due to an enlarged prostate, benign or malignant, pressing on the urethra, obstructing the flow of urine. Inability to urinate. While standing. If you are a man and find that you cannot urinate comfortably while standing as usual, but have to sit down, bend over, or strain to urinate, it is a worrying sign of prostate compression. Burning or painful urination or ejaculation. A burning, stinging, or uncomfortable feeling when urinating, or especially after ejaculation, can be caused by an infection, blockage, or a growing prostate tumor pressing on sensitive areas. Frequent nocturia. Waking up multiple times at night to urinate can not only disrupt your sleep and affect your quality of life, but can also be a sign that the prostate is pressing on your bladder, reducing bladder capacity, and causing irritation. Unexplained weight loss. If you lose weight suddenly without any changes in your diet, exercise, or lifestyle, be extremely alert. Advanced prostate cancer can alter your body's metabolism, leading to unwanted weight loss. Persistent bone pain. Feeling pain in the bones, such as the spine, hips, ribs, or shoulders, for no apparent reason, especially if the pain is dull or severe, and does not improve with rest. This could be a sign that cancer has metastasized, spread, to the bones, a more serious condition. Unexplained persistent fatigue. If you feel exhausted, lethargic, or lacking in energy despite adequate rest, it could be a sign that your body is fighting a serious illness such as cancer. Cancer-related fatigue is often difficult to improve with normal rest. Blood in the semen, hemospermia. Finding blood in the semen after ejaculation is a serious warning sign, possibly because prostate cancer has affected the small blood vessels in the prostate or nearby seminal vesicles. Seek immediate medical attention. Weakness or pain in the legs and feet. When prostate cancer spreads to the spine, spinal cord, or nearby nerves, it can compress the nerves, causing muscle weakness, numbness, tingling, or pins and needles in the legs and feet. In severe cases, it can lead to loss of bladder or bowel control. Persistent pain in the pelvic area, lower back, or upper thighs. A dull or persistent pain in the pelvic area, lower back or upper thigh, inner or back, can signal that the cancer has spread to nearby lymph nodes or bones, causing inflammation and nerve compression. Erectile dysfunction, ED. Difficulty achieving or maintaining an erection is not only a common sexual problem, but can also be one of the potential signs of prostate cancer. Additionally, ED is a common side effect of prostate cancer treatment such as surgery or radiation therapy. So, what causes prostate cancer? Prostate cancer occurs when the DNA in prostate cells changes, mutates, in an abnormal way. These mutations can be inherited from your family, for example, your father, brother, or uncle, or they can also appear randomly during your lifetime. Notably, certain genes such as BRCA1 and BRCA2, which are well known for their role in breast and ovarian cancer in women, have also been shown to increase the risk of prostate cancer in men. In addition, there are other risk factors to keep in mind. Diet and weight. Research shows that consuming too much red meat, processed meat, and full-fat dairy products can increase the risk of the disease. Conversely, a diet rich in fruits, vegetables, and whole grains reduces the risk. Obesity is also an independent risk factor for prostate cancer. Smoking and alcohol. These are two bad habits that contribute to an increased risk of many types of cancer, including prostate cancer. Smoking is especially linked to more aggressive forms of prostate cancer. Race. Unfortunately, men of African descent have a higher risk of prostate cancer and are often diagnosed at a younger age with more severe forms of the disease than other racial groups. Family history. This is one of the strongest risk factors. If your father or brother has had prostate cancer, especially if they were diagnosed younger than 65, your risk doubles or even triples. How can you be proactive in preventing prostate cancer? While there is no way to guarantee that you will not get the disease 100%, you can significantly reduce your risk by adopting the following healthy and proactive lifestyle habits. Eat healthy, diverse. Turn your plate into a colorful garden. Increase fresh vegetables, berries, beans, whole grains. In particular, add fatty fish rich in omega-3 such as salmon, mackerel, and tomatoes. Cooked will help the body absorb lycopene better, a powerful antioxidant that is beneficial for the prostate. Limit red meat, processed meat, and fatty dairy products. Maintain a healthy weight. Maintain a reasonable body mass index, BMI. Reducing obesity significantly reduces the risk of prostate cancer and many other chronic diseases. Exercise regularly. Aim for at least 150 minutes of moderate physical activity each week or 75 minutes of vigorous activity. Brisk walking, swimming, cycling, and gardening are all great options. Exercise helps control weight, reduces inflammation, and improves overall health. Regular checkups and screenings. This is the most important part of protecting yourself, especially If you are 50 or older, or if you have higher risk factors, e.g. family history, race, talk to your doctor about prostate cancer screening. Tests like the PSA blood test and digital rectal exam DRE can help detect the disease early, which gives you a much better chance of effective treatment and a better prognosis. Never ignore any of the signs listed above. Listen to your body and take action. Your life is more valuable than ever, and your health is your most valuable asset. If you find this information useful, don't forget to like this article, subscribe to our channel to receive more valuable health information, and most importantly, share this article with your loved ones' friends, especially the men you care about. Spreading awareness can save a life. Question for you. What are you doing to proactively protect your prostate health and the important men in your life? Leave a comment below and share your valuable tips and experiences.